Okay, so this is a video to assist with thoracic opening, and this is great for anyone who has neck, shoulder, or any sort of difficulty in the thoracic region. This is really, really great to improve coordination, decrease pain, and increase overall not only mobility but ability to use the thoracic spine the way that it's built. So what you're going to do, and there are lots of different options, I'm going to give you a couple. The first way to do this is you're going to cross your arms. You don't want to have them pulling down on your shoulders. You want them to be like, actively engaged and holding, but not tight. So you're just gently resting your hands, kind of like the amount that you would rest your hands, maybe like, lightly, say that. And what you're gonna do is you're gonna slowly rotate to one side, repeatedly. And you'll probably feel some things in your thoracics. You're gonna do this seated. And so you're rotating to one side 20 to 25 times. And the main thing to keep in mind, you can muscularize this as much as you want. If you've done yoga and you're used to opposing forces in the body, as I rotate towards the right, I'm engaging my left hip backwards. I'm exaggerating so you can see it. So I'm exaggerating, I'm bringing my left hip back. It's incredibly engaging for my abdominals. So as I rotate towards the right, I reach my left hip back. It's huge engagement of my abdominals on both sides, and then I come back to the middle. So I do this 20 to 25 times going one way. Then I'm gonna switch to go the other way, 20 to 25 times. In the middle, I wanna make sure, do I notice a difference between the side I just did and the side I'm starting to do? Absolutely yes. Even after doing just 5 or 6, absolutely I notice a difference. The other piece of this, so we have one piece is when I rotate, I have the opposing hip reaching back to counter. So I have this really nice diagonal happening. The other piece, so the second piece of this, and this can be done on both of them, is to lengthen through the crown of my head as I go. That's gonna give me the most out of this exercise. So I could do it either by putting a hand on top of my head to remind me, or if I wanted to go for extra credit, I could put, in this case, Captain Marvel on top of my head, who joined us for my last study group, and I've never done this before, but I could try, oh, that's fantastic, why didn't I think of this sooner? I could try to do it with her, oops. And so this would be that you're going to rotate 20 to 25 times one way, rotate 20 to 25 times the other way. If you find that your neck and your shoulders are getting tight when you do this, do it with your eyes closed. That's gonna help you really get the rotation from your axial skeleton. A lot of times when people's eyes are open and they're looking around, sometimes it's wanting to happen from the neck. In this case, you wanna make sure to avoid that. So a way to avoid that is to do it with my eyes closed, continuing to do all of the opposition in the body, and then from there, that can ensure that I'm not using my neck.